Okay, we're going to go ahead and get started. Good afternoon, everyone, and welcome to our monthly School Health Services Multidisciplinary Information Session. I am Mary Cruz Lopez, Community Engagement Specialist with Nevada Health Authority. I do want to note today's session is being recorded and will be posted on our website. Today's session is on family communications on school health services, and we have Monica Romero from the Nevada Department of Education, who will share simple strategies and tools to explain Medicaid-covered school services and review helpful materials and answer any common questions that parents may have. So I'll go ahead and pass it off to Monica.
Good afternoon, everyone. Thank you for joining us today. And I also do want to introduce Annabelle Sanchez. She is our family engagement specialist, and she will be teaming up with me today. So once again, thank you for being here. I'd like to share a vision of our partnership with UNR, Nevada Health Authority, and Nevada Department of Education. Our vision is we work behind the scenes to align education, healthcare systems, and provide clear, consistent guidance to districts. Our shared goal is to help schools deliver high-quality support that complements the care students receive in their communities and support their overall well-being. Today, I will be focusing on strategies to help with family partnership and school health. The agenda is academic and school-based mental health, family communication, addressing common questions, engagement strategies, and lastly, we'll be sharing a sample Medicaid flyer that Nevada Health Authority has put together for us for your use. So I'm going to begin in this session. Nevada Department of Ed will share strategies and tools for effectively communicating with families about school-based mental health services to include Medicaid-covered services in schools. We explore messaging approaches, review sample materials, discuss how to answer common parent questions, and cover the essentials of consent and access. Our shared goal is to work behind the scenes to align our education. These two paragraphs are our very own Clark County School District had a special education advisory council meeting, and that is an example of how some of our districts are getting the word out to help our parents understand the expansion beyond 9 IEP. I've also taken a little bit of a clip from our Michigan Health Information Network shared system, many things that we've learned from Michigan, and explaining how important it is to have parent consent before requiring Medicaid billing can occur. I'll go to the next slide. The next slide is a very quick overview of our main mission is for our students to become very successful in academics. So here you will see how we must build the knowledge, and it's no different of building our knowledge with schoolhouse services at all aspects of the nurse, our counselors, our social workers, from very young K through 6 and then on to junior high and high school, mastering the content in order for our students to get grade level instruction, problem solve, and reaching goals. These priorities aren't separate initiatives. So in recognizing that we inform families and our strategic multiplier for everything we do, whether we're building literacy or mapping career paths, these efforts only reach their full potential when families are informed and engaged as essential partners. Through national research, they have shown that active family engagement dramatically shifts at-home habits and significantly boosts student proficiency scores. Next is, once again, I'm trying to switch over. There we go. When it comes to healthcare, an engaged family makes a measurable difference. Without family engagement, we risk outdated medication, prescriptions, or unaddressed crisis warning signs. But with active family partnership, we see seamless updates to healthcare plans, rapid transitions to professional clinical care, and early warning signs spotted collaborative for all students. Right in the middle is our informed families. In the classroom is the strong foundations of literacy. And when we align the systems, our students benefit. Now, this is just a small reminder. Prior to 2019, we were eligible in the state of Nevada to bill for IEP services. And due to Nevada Health Authority receiving permission to expand, now we can expand into other services outside of the IEP. Now I will pass over to Annabelle Sanchez. She's going to discuss the next slide.
Hello, everyone. And yes, I will. I will be reviewing some few of the common myths and realities. Oh, next slide, please. Within Medicaid, we often encounter common misconceptions for families, and it is crucial to identify and clarify these financial and administrative realities. So if you see on the screen there to the left, Medicaid and school funding, the myth being that billing Medicaid reduces state funding. The reality is that these funds are supplemental and do not supplant state or local funding. And then on the other side, the consent requirement, the myth is that districts bill automatically without family knowledge. The reality is that there's a one-time signed consent for release of information that is strictly required. Next slide, please. I will pass it back to Monica briefly.
Thank you, Annabelle. Now let's review the most common parent questions and the facts we must communicate clearly. Number one parent concern is if the school bills Medicaid, will it use up my child's limit for our private community clinic? And so the fact is that our community service operate entirely independently under a dual track healthcare model. Schools are officially designated as provider type 60, meaning services and limits are counted completely separately and do not cross-reference or affect community prior authorization. School-based care will not decrease a child's private community therapy limits or benefits. And another common myth is districts will just bill automatically without my knowledge. That is not allowable. So the fact is a one-time signed consent form release of information is strictly required to authorize any billing. Consent is entirely optional, and withdrawing it does not affect a student's access to care. To make this easier, many schools are now implementing digital consent collection through electronic parent portals. Another common concern is billing Medicaid just reduces our state education funding. The fact is that federal Medicaid funds are supplemental. They do not supplement or replace any state local funding. Instead, they help cover vital costs for screening, therapies, and nursing, as seen on the slide. School health services uses type 60. Community providers provide the services at private clinics, specialists, or hospitals. The service limitation is counted completely separate, and prior authorization does not affect community authorization, operates under its own standard requirements. Here, this slide explains the cycle of engagement, supplemental funding. Here is when we empower staff to debunk these myths and build community trust. We create a positive cycle. Informed families are confidently navigating the system and sign digital consent forms. This unlocks Medicaid reimbursement for our services, generating supplemental funding that flows directly back into our schools. That funding expands our capacity for more health services screening and further family engagement. Next, I will pass it on to Annabelle.
And yes, in this section, we will be addressing some common parent and family questions that you may encounter. Next slide, please. We're going to practice a script from 4 hard questions. So on the left side in the kind of teal color, I will state those and then Monica will show us how you might respond. So I am the parent and she is the person who is responding. First one, I am not on Medicaid.
Consent simply allows us to check eligibility. If you aren't enrolled, it helps with ease of access of care in the schools.
How will this help my child?
These funds supplement our state funding, helping us bring more resources like screening therapies and nursing care directly into the school environment where your child spends their day.
My child does not receive services.
Even if they don't right now, signing the consent ensures that if a medical need arises in the future, we're already positioned to support them without delay.
There are some family engagement strategies that we would like to share. Next slide. Okay. A huge component of family engagement is also expanding the conversation ecosystem. Channels for conversation should be differentiated, repeated, and varied. Some of the examples you'll see here are short videos using parent-friendly terms that explain the Medicaid billing process, live question and answer sessions, and family universities that assist in addressing common parent concerns, website links, which include community partners and the school newsletters. Next slide, please. At the Nevada Department of Education, it is organized into two entities. The first one on the left being the Office of Parental Involvement and Family Engagement, also known as PIFE, which works with local education agencies, also known as LEAs, to inform them about policy and funding and events, and provides a report outlining all PIFE initiatives on a yearly basis. The second one being the Advisory Council for Family Engagement, which reviews PIFE-related policy and best practices that are used by LEAs and determines the need for dedicated PIFE coordinators within the state. Next slide, please. Activating this on the ground requires trust and not just technology. So in this table, you will see on the left what most of our school districts are doing: two-way communication, infinite campus messaging, literacy, and math night, hosting those events. However, our urban and rural districts look very different in how they promote two-way communication or any type of communication means. In urban districts, this might involve family engagement units, parent-teacher home visits, and family universities. In the rural districts, they've come a long way, and we lean on parental involvement committees, family and community centers, superintendents attending podcasts and radio times, and the mental health webinars. Some of the school districts are attending those as well. Next slide, please. And I will now pass it to Monica to share some of the staff and community strategies.
Thank you, Annabelle. Let's see if this will get good to me. All staff can be made aware of updates. Universal staff to include bus drivers, coaches, all that can be informed of the newest expansion in case of their everyday life. Hearing our parents and students at bus stops, pick up, drop off, we could also make them aware of services that are entitled to all students. But if a student does qualify for Medicaid, then it could provide funding for your school. So furthermore, a sustainable system cannot rely solely on the rarest, most expensive clinical license. We must expand our array of providers to prevent bottlenecks. This includes a tiered approach starting with our universal staff and our community, like teachers and coaches, and moving on to our bachelor level parapros, like wellness coaches and mentors, all the way up to licensed providers. So our SIPs are very vital to providing the necessary supports for all of our tiered systems in the schools. And almost close to the end here, this slide, it's showing you some research that was provided by FAST program. It's an impact of engaging families is proven. Over 35 years of national research shows that when families are empowered, children thrive. For example, the FAST program showed 95% of parent satisfaction rate, and active family intervention shifted at home reading habits dramatically, with 72% of parent reporting reading to their children 4 or more times a week. So this example provides how our school mental health, school wellness, nurses, counselors can integrate academic and behavioral health all together. Then next, if Maricruz, you wouldn't mind explaining the next slide?
Hi, yes. So we have been working on a flyer. It's a one-pager that can answer common questions that parents may have regarding Medicaid billing in the schools. We want parents to know that school health services, the school health service program helps districts get reimbursed for certain medical necessary services provided to Medicaid eligible students. These services support students' physical and emotional health so they can succeed in school. All services are provided by the school district at no cost to these families. So we are working on this flyer, and I'm hoping to have it translated and get it out to the districts before school starts this fall.
Perfect. Thank you, Maricruz. And then next, we'll make these slides available to you. Here's a fun infographic explaining 3 ways we partner for your children's health, myth and facts, as well as measurable difference with family engagement makes. And the last slide is you're not expected to be a billing expert. You are the trusted bridge to families, and we are here to support you. And we're available for any questions. We have many knowledgeable folks on the call, so if you have any questions that you have, we'd be happy to try to answer. If not, we'll get to the answer. That's a great suggestion. Thank you, Princess. Could the health plans be included in the distribution of the SHS flyers? Great idea.
I wonder though, hey Princess, this is Dana Robinson. I wonder, I don't know about the health plan school services. So PT60 is a carve out of Medicaid and it doesn't fall under the MCOs. So how would we add them? What are you thinking?
Oh, I just meant when the flyer is ready for distribution. That way we also have it available for our health fund members who might have similar questions for the state.
Oh, yeah. It might be worth doing its own because it does come up a lot. Like if I do have, like, if I have a managed care organization in Washoe County, can I access school health services? So I wonder, I don't know, Mary Cruz, what do you think? If it's worth doing a separate one or does it elicit a lot of questions?
I think, sorry, Marcus. Specifically for each MCO, I think since we offer various things that might be specific to each MCO, we would have our own separate material. For example, Silver Summit Health Plan is working on school health services material for our members. And so if they have questions, they're more than welcome to approach any of the representatives or the coordinators for school health services. And then the flyers that are coming from Nevada Health Authority, we want to offer that as another resource in case they would like to look at that.
That makes sense. Okay, cool.
Cool. Thank you.
Nancy?
I was just going to offer my input as well. You know, we have all of our things that go out to our parents. We have our websites, we have this, that, the other thing. And many times the parents call because they want to find out how they sign up for Medicaid. So we, of course, refer them back to, you know, Nevada Medicaid, but I think that if you had, like, I get what Princess is asking in the distribution, like she just wants a copy of it, but keeping it very separate on flyers, because I think it's confusing enough to parents as it is. And we've just really started in our district trying to separate, like, if you need to apply for Medicaid, this is who you call and this is where you go. This is just the consent to release the information for services. So that's just been our experience here in Clark County.
Thank you for the feedback. I will definitely take it back. And I was thinking more of having the schools enter their own information on the flyer. Hopefully, I'm going to go back, and I'm thinking of making it like more of a trifold. And then the schools can put their information, and then we'll have the website to school health services on there for NVHA, and you'll be able to customize it a little bit more.
Thank you, Nancy. Anything else?
I do want to say for Silver Summit, we actually just finalized our specific material. And so we'll be sending that out hopefully by next week. So I just want to give a heads up to everybody here.
Thank you. Any other questions for Monica and Annabelle?
Nancy,
No, but I
has one?
see Nancy Cool's questions in the chat, so I don't know if I would be the best.
Yes, please.
person
Any
to
district
answer
folks.
that.
Please, districts.
Got it. So Nancy, for years and years and years and years, we always did it through the IEP process before free care. And then once we have the expansion, we have we have it in Infinite Campus. It is not pushed out, meaning the parent doesn't have to answer it to move on. They just have to check that they read the information. So we do so much outreach with our district. We send quarterly emails. So every quarter, that's what it means. I don't know why I said that. We send quarterly emails to all the students who are missing consent on file within our district, which is like 240,000 or something. It's a big number. We do targeted for kids where we're just missing consent. We have everything else. We just try to push something through to try to make it a part of the school's jobs, but that did not happen. So we also are relying on our service providers, on our, our speech therapists, and then, highly on our schools for our special ed services, but for our gen ed services, we're really struggling for a lot of the, pardon me, a lot of the reasons that were presented in the PowerPoint.
Nancy, this is Nancy Cool. Sorry, I'm off camera. I have a quick, would you be okay sharing with other school districts how? Just kind of like this is kind of a game plan, or this is a way that we've done it. Because we have districts that are stepping into this for the very first time and getting them comfortable. Thank you.
Got it. I will do that. The one thing I will say is that our electronic signature within Infinite Campus, we actually had Infinite Campus build something for us from an outside vendor. So I don't know. It was right before I got hired. So I don't know how they did that, but yes, I will put together like a little cheat sheet, and Monica, I'll send it to you. Just a little cheat sheet of what we've done to obtain consent. And I'll also send you, hold on, I just want to make sure I want to make sure I could read my own notes later and understand what I was supposed to do. So that's what CCSD has done, is that I also have a lot of materials from other districts across the state and the country. Some for smaller districts, what to obtain consent. So I will gather this information. Just give me a couple of days to get it together on a sheet, and then Monica, I'll send it to you.
Any other questions? Okay, well, thank you so much to Monica and Annabelle for today's presentation and everyone who's joined. As a reminder, this is being recorded and it will go on our website. I'll go ahead and put any additional documentation on there that's being shared today. Our next session is July 21st. And I know the link isn't up on our website yet, so we're hoping to get that up soon. So more information to come on that. But thank you everybody for being here.